In my job as an infectious disease specialist, I quite often have to counsel people with a newly diagnosed HIV infection. So they come and I have to tell them that HIV test was positive. And there's a big difference if you talk to one of the major risk groups in Germany, who basically all know about the impacts of an HIV infection. They have friends who are treated already. They knew it can be treated. They have made experience that their colleagues, their friends can continue with a normal life. And they are, of course they are not happy about the diagnosis, but most of them are not really deeply depressed. They are usually quite well informed and know about the basic implications of the disease. When you talk to, for example, a Somali who just came across the Mediterranean Sea and is now, after all his journey, confronted with such a problem, in his experience, this is a death penalty. He knows from his own experience at home, maybe, that even family members got the diagnosis and they died within a few months in agony. There's a lot of stigma around this disease in these countries, and in their point of view, this is the end of a normal life. They do not expect to have a family, they do not expect to have a professional career, and this puts them into a deep depression. And what you have to do in this situation is to counsel them well. And so I made a good experience to ask them before, what do you know about the disease? What is your experience? And then I can answer and put something against this experience and tell them that situation in our country is different than in their home country. And there's always a good chance to live a normal life. From our point of view as doctors, we always focus on the disease, and we must know that in the reality of the patient, other things might be much more important. He might have family at home he left and which are still in danger. There are administrative problems. He is afraid of getting deported. Maybe he has no money to come to our place to get checked again. All these things makes it difficult for the patient to be compliant to our medication and to come to our appointments in a regular time. And most of them are also not used to our schedules we have in our lives. If you tell them, please come at 9 o'clock, for them it means I have to show up any time that day, and it may be 3 o'clock in the afternoon. So we have to be patient and offer a certain flexibility. Despite all these problems, the work with refugees is for me very rewarding.